Welcome back to the Herbert and Jacqueline Krieger Klein Alzheimer's Research Center in Rutgers. Today, I will introduce you into the strategy we have chosen in order to maximize the effectiveness of our research in finding solutions for Alzheimer's disease. Our strategy has three main pillars. The first pillar is of observational studies. What that means is that we're going to build a cohort of offspring of Alzheimer's patients since they have a high risk of developing the disease. And we're going to characterize them in depth, their lifestyle, their cognition, their brain, using MRI brain imaging, their blood, their biomarkers, their behavior, everything that we can, we're going to characterize to understand in those high-risk people what is contributing more or less to their future decline, and also what is contributing to decrease the risk of developing the disease. The second pillar is of clinical trials. What we mean by clinical trials is truly testing new medications, new interventions. They could be lifestyle interventions that can change the course of the disease. In other words, that instead of a person declining very fast and developing severe Alzheimer's disease, to change the course of the disease so it's almost flat or non-existent. The third pillar, in fact, connects between the observational studies and the clinical trials. We call that the translational pillar. That's a jargon that we use in the scientific language when we want to connect between animal model studies, cell model studies, studies that are not on humans, can be translated to humans as new medications and new treatments. That means that we will be working with basic scientists whose expertise is to develop or discover molecules, proteins, different pathways that may lead to new medications for Alzheimer's disease, and then move that into the clinical trial field, testing those new molecules and proteins and pathways as medications against the disease.